Bovine herpes mammillitis and inclusion body rhinitis. So bovine herpes mammillitis, the occurrence in the EU is rare. It occurs in warm and rainy weather conditions, such as the USA, Australia, and in Africa. In Africa, it causes pseudolumpy. It's very similar to lumpy skin disease. The etiology of the disease is alpha herpes virus has a simplex virus genus, which has the bovine alpha herpes virus 2. Remember, bovine alpha herpes virus 1 leads to infectious bovine rhinotracheitis. So the epidemiology of the disease. The host is mainly cattle, specifically heifers, and buffalo. These show clinical signs. Other ruminants can be seropositive. The virus has a localized infection which leads to edema and pustules in the skin, teeth, and udder. The virus requires skin damage. The virus can't get through the intact skin. The virus can spread through contact with arthropods, which damage the skin and pass on the virus, or can be spread indirectly by milking machines. This can be the main form of spreading the virus. The arthropods can be mechanical vectors, but there's no replication with them. The virus can cause a lifelong infection and latency, and the infection can have a sporadic occurrence. So the pathogenesis. Skin abrasions lead to local virus replication in the skin, which then leads to viremia, and then secondary replication in the skin, teeth, and udder. This then leads to epithelial cell damage, hemorrhages, necrosis, and degeneration. In the udder, a secondary bacterial infection can occur, which then leads to mastitis. The clinical signs. So a subclinical infection is common, and the recovery is about 1 to 2 weeks. The clinical signs are edema, reddening or thickening of the udder and teats. Vesicles can form, and they can rupture, leaving ulcerated scabs, which are painful and they can crack. It's often very painful for the cows to be milked, and this is often due to the mastitis, which is caused by the secondary bacterial infection. Pustules can be observed on the vulvar and anal regions of the cow, and on the lips of the calf due to suckling. The development of scars and plaques can make milking a lot more difficult. In Europe, there's a localized form of the virus, and in Africa, there's a generalized form of the virus. It's similar to the pox virus. For the pathology, nothing's really done as there's a very low mortality and the animals don't die. For the diagnosis, we can do a PCR from the lesions, viral neutralization, and the isolation is difficult. The differential diagnosis can be foot and mouth disease and cowpox. For the treatment, you do a supportive and symptomatic treatment. There is no vaccination, and general ways to prevent the virus is from isolated keeping, separate milking machines, and arthropod control. The next disease is swine inclusion body rhinitis. It occurs worldwide and it's frequently seropositive in swine, almost 100% of pigs, but it's mainly subclinical. This is very similar to the human herpes virus. The etiology of the disease is the beta herpes virus includes the swine herpes virus 2. It is an unassigned cytomeglia virus. The histopathology of this virus is almost impossible, and in vitro propagation is very difficult. The virus causes a latent infection and affects the lacrimal glands and the nasal mucosa. For the epidemiology, it's species specific. It only affects swine. There can be a horizontal and vertical transmission of the virus, and it mostly affects piglets from 1 to 3 weeks. This is when they're most susceptible. For the pathogenesis, an airborne infection can cause primary multiplication in the nasal cavity. This causes cell-bound viremia in the lymphocytes and alveolar macrophages, which then leads to a secondary replication in the nasal epithelium and other organs. This can lead to hemorrhages, necrosis, and exudate. For the clinical signs, it has an incubation period of 10 to 20 days. Piglets under 3 weeks old are very susceptible. The symptoms are anorexia, fever, sudden death, but mostly bloody nasal discharge. In adult pigs, it's a subclinical infection. It mostly has respiratory symptoms such as sneezing and conjunctivitis. And in pregnant sows, it can cause abortion, stillbirth, and weak fading piglets and reproduction problems. For the pathology, we can see hemorrhages, edema, exudate in the nasal cavity, but the animals usually don't die. For the diagnosis, we can do a histopathology of the nasal cavity. It's cytomegaly, and it's pathognomstic. We can see giant cells with intranuclear inclusion bodies. We can also do a PCR and an IF, and ELISA is not good because of the latent infection and since the animals are seropositive. For treatment and prevention, good husbandry is the solution. The disease only shows up when the hygiene is bad. There is no vaccination. Colostrum protects the piglets up to 3 weeks old, past their most susceptible period.